Hey guys, Blake Schwank here, but just with an update on the Change Healthcare attack. And as you guys remember, or we talked about it before, on February 21st, there was a breach at Change Healthcare, which handles and has access to about a third of everybody's medical records. But they do mainly pharmacy billing and a bunch of other stuff. But on February 21st, they announced the breach and they started shutting down equipment. The interesting thing is, on analysis that came out this week, is the hackers actually had access on February 12th, and they roamed around in the network laterally looking for ways to attack it. Now, we've talked about ways to protect yourself from this kind of stuff. Well, let's take a step back. They first got in using an account on a system that did not have MFA enabled, multi-factor authentication. Now, there's a good chance that that would have at least slowed them down, if not all out prevented this. So we want to make sure that we have multi-factor authentication on there. You probably have systems out there that don't have it. You want to make sure that anything that is critical, anything that has access to your system, has multi-factor authentication enabled. But then they got around and they roamed around in this network. And if you have multi-factor authentication like Duo, something like that in place, and somebody makes it past that, then we want to have something that catches that lateral movement. And that comes in the form of managed detection and response. We're a big proponent of managed detection and response, especially for our healthcare clients. What this would have done is it would have caught the lateral traffic. And we had a great example of this. One of our clients, a healthcare organization, week before Thanksgiving, our cybersecurity center called us and told me that, hey, we found this nurse station that was crawling the network and we pulled it off the network. That's what happens with managed detection and response. When somebody starts doing traffic that is unexpected laterally across your network, doing research, scanning the network, doing things that are inappropriate and not normal in a business or in a healthcare environment, it flags it and it immediately disconnects that device from the network, and then they ask for forgiveness. They don't worry about maybe breaking something because the risk is much bigger that you're going to be shut down. And what's the cost of getting shut down? So Wired magazine says that Change Healthcare or United Health ended up paying the hackers about $22 million in Bitcoin to protect the patient data. And that patient data includes private information for a lot of people that are stored in the Change Healthcare system. How many people is absolutely unknown, but they do touch about a third of patients that are out there. The overall cost, according to United Health, as of last week, is now up to $870 million. That's massive. So make sure you protect yourself. So if you don't know what this MFA stuff is, multi-factor authentication or something like Duo, if you don't know what managed detection and responses, if you don't have these tools in place, Colorado Computer Support can help you out with things like Duo, like Blackpoint, things that will protect your network from these hackers so that this doesn't happen to you. Now, you may not have, I can't even imagine what $870 million is, but if something cost my business $500,000, $250,000, that would be crippling. Let's protect your network from that. So if you have questions on that, give us a call at Colorado Computer Support. You can find us on the web at www.coloradosupport.com.